Shashikala, Rupa,
Good morning, ma'am.
is your immediate dependent. First is grab forceps and clamp the chest tube proximal to the client thorax. Second, take the chest tube and attach to the wall suction. Third, keep the end of the chest tube sterile and contact physician. Next, place the end of chest tube in container of sterile water.
Fourth one, ma'am.
What is the answer?
Fourth one, ma'am.
Fourth one. Yes. Why? What is the first step? Immediately, if you have an option of, okay, listen, you can also think of grabbing the end, clamping it. Proximal. No, not at the proximal. At a distal end. So this will not be the answer. So this is the answer. Okay. Next. Going to the next question. Okay. A client pulled his chest tubing out of his thorax. What is initial nursing intervention? A client?
Occlusive dressing.
Okay,
Glove hand.
A client pulled out the chest tube. Arrange for chest X-ray. Chest X-ray. Or reinsert the tube. Notify physician.
Good evening, ma'am. Sorry for late.
It's okay. Notify the physician. Place the Vaseline gauze. What will be the answer?
Place the Vaseline gauze, ma'am.
Place the
Vaseline
gauze.
Vaseline gauze. Why?
Because that tube came out from the thorax.
Very good. If the option would have first, you would have gone for your gloved hand.
Glove.
Okay. If the question is stating that it want to be if you have an option of placing a Vaseline gauze, then go for this Vaseline gauze. Okay. Next. Write it down. Okay. A nurse is assessing you had to listen to the question, okay? There's a patient of, you had a patient of thoracocentesis, okay? And what is the complication, immediate complication of thoracocentesis? Thoracocentesis, immediate complication. Pleural effusion. Pleural effusion. Pneumonia. Pulmonary emboli.
Pulmonary emboli, ma'am.
Yes, ma'am.
Or pneumothorax. Thoracocentesis, immediate complication. Pleural infusion, pneumonia, pulmonary emboli, pneumothorax. Bhavna.
Ma'am, I'm confused between pulmonary emboli and pneumothorax.
Think it what, okay, if you're confused in answer, then think it in a way that what exactly you're doing in your thoracocentesis. Tell me.
First option is what?
Pleural effusion. Yes.
Pulmonary embolism.
Pulmonary emboli. Okay, then why do you think that pulmonary emboli will be the answer?
During the procedure,
Ma'am, pleural effusion is an accumulation of fluid now.
Yes. Yes.
प्लूरल एफ्यूजन थोरेकोसेंटेसिस में हम फ्लूइड रिमूव करते हैं.
तो pleural effusion के अंदर क्या हो सकता है? आप you're trying to remove a fluid from the cavity, from the lung pleural
Yes.
space of a patient through
Yes.
thoracocentesis. What do you think that
I
what
think,
can
ma'am,
be immediate complication?
I think, ma'am, pleural effusion.
What is pleural effusion?
Accumulation of fluid in the pleural space.
In the pleural space. So you're
Pleural
removing
cavity.
it. So why you think that it can be a complication? Removing fluid. Think something else.
Because there may be a chances like pneumonia या फिर heart issues if patient have accumulation of fluid in the space.
During the procedure, it maybe chance to the pulmonary embolism.
This is the pulmonary emboli will when happen. When do you think that pulmonary will happen? When there's a blood status
No.
and there's a clot in your pulmonary. This is
Some
called
confusion है.
pulmonary embolism.
मैम ज़्यादा टाइम तो pneumothorax
Do
में
you
था
think
but
is anyone thinking about
Pneumothorax.
pneumonia? Pulmonary pneumothorax. What is pulmonary pneumothorax? What is
ma'am
pneumothorax?
leakage of air like leakage of air in the pleural space.
Yes. You're
So
putting
I
a
think, ma'am,
needle.
pneumothorax.
Yes, pneumothorax. Think it very basically. Don't go for anything which is very big or something. Just think you're putting a needle. So pneumothorax will be your answer. Understood?
Yes, ma'am.
Yes, ma'am.
Okay. So let's next go for the next question. Next question says that
मैम यही प्रॉब्लम होती है एग्जाम में
हाँ
क्योंकि वहाँ पे
basics
प्रेशर होता है माइंड और फिर टाइम बाउंडेशन भी होती है तो फिर कुछ भी टिक कर देते हैं.
ऐसे नहीं करना होता. देयर इज नो टाइम बाउंडेशन. आपके पास अच्छे खासा टाइम होता है बट व्हेन यू विल प्रैक्टिस you will do not feel that way कि there is a time foundation or something like this. It will become very easy for you to do these questions. Okay, so let's go for the next question. Write it down. A nurse is caring for a client with a chest tube for a treatment of pneumothorax, which is the essential to have at a bedside. You are doing a chest tube for a patient of pneumothorax. What is the essential thing you are going to keep it at a bedside? You tell me what do you think? Nasal cannula oxygen. Okay, I'm giving option. Nasal cannula, tracheostomy, sterile water, bottle of sterile water, ampule or dextrose 50%.
Ma'am, can you please repeat the questions?
Okay. First is nasal cannula. Second is your tracheostomy. Third is your sterile water. Fourth is your ampule of dextrose, 50%.
What are they asking in the question?
The question is asking, you are caring for a patient who is having, you are caring for a patient and you are inserting chest tube to a patient with a diagnosis of pneumothorax. So what you are going to keep in the bedside of a patient?
St-
Ma'am, I think I would go for a sterile water.
yes, ma'am.
Why sterile water?
Oxygen, ma'am. Oxygen tube.
Ma'am, can you repeat the
Think
question,
again,
ma'am?
everyone. You are
Ma'am,
going in
can
a wrong
you,
direction.
ma'am, can you share the screen with the questions? The
Ah.
The
options.
questions are very
It would be easier.
handwritten. It's like it's in my notebook.
Oh.
That's why you can't share it.
Ma'am. So can you
There was
repeat,
some-
ma'am?
I want to, yes, I can. Okay, there's a patient with a diagnosis of pneumothorax. Okay. And you are putting chest tube to a patient. What is essentially you need to keep at a bedside? Pneumothorax,
Chest tube.
chest tube,
What do you put in there? Okay. We'll put sterile occlusive dressing or sterile
but this is
dressing.
not an
or
option. 50% dextrose, nasal oxygen, or there is a tracheostomy set, sterile water, and dextrose. Among these four, you have to tell me the answer.
sterile water, ma'am.
Sterile
Yes,
water,
ma'am.
very good.
I
Why?
think
Because
sterile
Because
water.
like in case if it is the
For
seal
like
is
any leakage or that then prevents.
yes, okay, very good. So that's why sterile water. Okay. Okay. Did we study about a disease called cystic fibrosis? Yes or no?
No, no, ma'am.
No, ma'am.
So we are going to study about cystic fibrosis and we are going to do questions about cystic fibrosis because I want to teach you about cystic fibrosis. So open your notebook and write about cystic fibrosis. Does anybody have heard of cystic fibrosis disease?
Yes, ma'am.
Yes.
मैम अभी तो मैं नहीं कर सकता, मैं काम में हूँ। ऊपर वो देखो ना, ताबिश का नंबर है, और अपने वो काम वाले व्हाट्सएप पे सर्च करो तो
So cystic fibrosis is a disease in which there is an abnormal gene. It's present in your body. So what is this abnormal gene? There's a gene called CFTR gene, which is located in chromosome number 7. What did I say? I said there's a disease which is called as cystic fibrosis, which is located in your
chromosome 7.
very good. It is located in your chromosome number 7. Whenever there is alternation in this gene, we get a problem called cystic fibrosis. Why? Because
And please repeat. Sorry.
yes, there's a gene called cystic fibrosis. This is a CFTR gene. Okay, this gene is responsible for making cystic, like a protein which balances your chloride in your body. This is responsible for your chloride balance in your body. Okay, so whenever this gene is get problematic, whenever a patient is having problem with this gene, then we cannot produce, we cannot balance our chloride in the body, and chloride is very much essential for our body to maintain the sweat and sodium and chloride as they work together. So what happens in cystic fibrosis? The patient, whenever there is a secretions, for example, there is a secretion which is present in your vaginal secretions. There is a problem with your lungs, and we have a problem with our pancreas. So this is a pancreas. So there are 3 organs: pancreas, your reproductive, your lungs, your pancreas, and your reproductive. Male and female both. Male and female both reproductive organs are get involved. Lungs get involved, pancreas get involved, reproductive organ of male and female. So what happened in this thing? Understand what is pancreas? Pancreas is
Yeah.
an organ which is
Insulin.
both. It's
So
a
it
gland.
filtered the insulin.
It produces your. It has
And
two function: exocrine and
Endocrine.
endocrine function. Right? Endo means
Outside.
outside your body. Exo means
Inside the body.
what does it mean? What is the exocrine and endocrine function of your pancreas? Can anyone tell me? Can anyone tell me the exocrine and endocrine function of your pancreas?
No, ma'am.
Okay, there's an important message that I want to forward on to. Please, can you send me your email address in the office number? Okay, everyone, it's important. Is I'm audible?
Yes,
Yes,
ma'am.
yes, ma'am.
I'm
Yes,
saying, can you
ma'am.
all send me your email address in the group?
Yes.
Okay, ma'am.
Just send an email address in the group, okay? Not in the group personally, not in the group because we're public, personally to the number.
Uh,
What number, ma'am?
Office number.
ma'am, that nurse prep 360 number,
Yes.
that one?
Yes.
Oh.
Yes. Right now it's important.
What is
We want to give you that form
Okay, got it.
registration, not registration, just
Sent home.
ma'am, this number na 4547771.
yes.
Send, ma'am.
Thank you.
Got sent to a public thing.
So this is what I stopped you for. It's okay.
Delete.
Yes.
Registration, ma'am, like registration for what?
It is like so whenever you will be ready to give exams, so you will also go for your registration to provinces like Alberta, CNO. So if you want to give you any kind of meal or something in the future, so we can just send you. Because contacting on phone number is not. Okay. So basically, this affects your three organs: your lungs, your pancreas, as well as your reproductive organs. So your pancreas produces two type of hormones. One is exo, one is endo. Endocrine means what is endocrine?
Outside.
Yes. Endocrine means without any duct, directly will pour your hormones into your blood, which is your insulin and your glucagon. Insulin is produced by beta cell And
Yes,
glucagon
ma'am.
is produced by your alpha cell.
Alpha.
Okay. What is exocrine? Exocrine is through this. There is a tube, there's a duct in the pancreas. Okay. So whenever there is isolates of Langerhans, and there is some cells isolates of Langerhans, and we have other type of cell which produce 3 type of exocrine hormone, which is known as protease, lipase, and amylase. So just understand one thing. This cystic fibrosis disease, this disease affect your secretions. They make your secretion go very, very thick. So they make secretions very, very thick. So whenever this protease, lipase, amylase wants to go out, will it able to go out through this duct?
No.
Why? Because there's no secretion, and secretions is very, very thick. This preventing it to go out of your lungs. Okay. So what will happen? Does your body will so this pour this secretion in the small intestine. This is my liver, and this is my small intestine. So they pour the secretion in the small intestine. From here. Your small intestine is responsible for your digestion of your food. Okay. So what happened? As you will not be receiving your amylase, protease, and lipase, what does the amylase do to your body?
For
Break down your
Good, ma'am.
no, but which food? It break down your
I think
carbs.
lipids.
Very good.
Carbs.
Carbs. Okay. What protein break down? What protease break down?
protein,
Very good. What lipase break down?
fat,
Lipids.
Fats and fat.
Lipids, fats.
Lipids. Very good. So understand one thing, in the cystic fibrosis, as you have very thick secretions in your pancreas, so
Pancreas.
no, first of all, fat, protein, and the carbohydrates. So the food that we're eating, like burger, pizza, or soup, chicken, it's called contains so many different type of nutrient. Will they get digested by your body?
No, ma'am.
Mhm.
I mean,
No, ma'am.
yeah.
It will not get digested by your body. So first thing is, your patient will be having lack of amylase, protease. So they will not digest fat, protein, carbohydrate from your body. Clear? Okay. Apart from this thing, we are unable to, so the patient will have malnourishment. Write it down. Malnourishment. Okay. If a patient is unable to break down fat, will a patient be able to break down fat? The fat which is digest your vitamin C, your fat soluble vitamin. So will your body be able to take fat soluble vitamins?
No, ma'am.
Elements.
So how will you see a patient of a cystic fibrosis comes to you? Very malnourished.
Yes.
Because the body is not able to digest fat, carbohydrate, and protein. As well as, will the fat will as it is removed out of your body without getting digested?
Not
Yes,
Your
ma'am,
fat
there would be fatty stools.
Yes, fatty stool. Fatty stool is called steatorrhea.
Victoria.
Do you know this thing? What is steatorrhea?
Yes, ma'am.
Fat.
Undigested fat will be removed. Undigested fat from your stool. Write a
stool.
characteristic of feature of your steatorrhea. Bulky, foul smelling.
Ma'am,
Write it down.
poor weight
Bulky,
gain भी होगा
foul
उससे ना?
smelling. Yes. Malnourishment, underweight, poor weight gain, milestone problem. Write a characteristic feature of a steatorrhea. Bulky, foul smelling, greasy, stool. Okay. Did you wrote all this thing?
Yes, ma'am.
Yes, ma'am.
Okay. Next. What will happen? Just understand one thing. So, will there be accumulation of amylase, protease, lipase in the pancreas? Because pancreas is producing amylase, lipase, but the problem is in the pathway. So, it will stay in your pancreas, yes or no?
Yes, ma'am.
Yes, ma'am.
Is your cell made up of protein, glucose, carbohydrate, and fat? Yes or no?
Yes, ma'am.
Yes, ma'am.
So don't you think if this
Yes, ma'am.
protease, amylase, and lipase is going to stay for longer in your pancreas, it's going to auto digest itself? And can you have a complication of pancreatitis?
Yes, ma'am.
So write it
Yes,
down.
ma'am.
Pancreatitis, underline it, is very important. So what will happen? So now what will happen? They will disturb your
Digestion.
pancreas, and this amylase, lipase, protease will go into your liver, into your lungs, and in your lungs there are small alveoli, and they will easily damage the small alveoli, causing it as ARDS. Apart from this thing, there's one more thing it is going to do. That is, now understand what exactly happening in your lungs. In your lungs are responsible for
Inhale,
your lungs are responsible for
Gas exchange.
inhale oxygen and exhale carbon dioxide.
your lungs are responsible for
Inhale oxygen, exhale carbon dioxide.
yes, and also to remove the secretions from your airway. So if your airway is getting compromised, just imagine this is a secretion. So there are so many secretions in your airway, eventually it is present. So if this is affecting your secretions of your airway, will your secretion will easily, will you able to cough out secretions? No. Secretions
ma'am.
will be get built up in your airway, and it will be
Yes, ma'am.
produce very thick secretions.
Secretions, yes.
So it will lead to pneumonia. It can also lead to your pneumonia. And your lungs will become fibrosis. Can lead to complications, pneumonia. It can lead to pneumonia. Okay. This is what happening. This is what happening in your pancreas, and this is what happening in your lungs. Okay, understand what is happening in the male. Maximum time when a child is born with disturbance in CFTR genes. So a male child is born with maximum time. The child is born with a problem called epididymis. There's an epididymis. You know what? There's a tube which is called epididymis, which take the sperm and move it into the urethra. Epididymis. Okay. So agenesis, and the child is infertile. Male child is infertile
Then
most of the time.
CFTR is cystic fibrosis. Next, trans what?
CFTR, transcriptase revertase enzyme. Transmembrane conduction regulation. CFTR is cystic fibrosis, transmembrane conduction, CFTR is cystic fibrosis, transmembrane conduction regulators. These are the regulators. Okay. So the child will have frequent cough. Okay. Frequent cough, thick mucus secretions, wheezing, poor height growth, poor weight gain, poor nourishment. The child will not able to digest food, especially of fat soluble vitamin, and deficiency of vitamins. Child will have pneumonia, coughing, and there's one characteristic feature is that a child will taste like salt. So when you will kiss a child, you will have a salty feeling in your mouth. A child will taste like a cough. Understood? Okay, very good. Now, next slide. What is this important is? Okay, so how can you manage this thing?
Will
How can you
give
manage this?
pancreatic enzymes, ma'am.
Okay,
Ma'am,
in
here
the
we
male,
clear
okay, listen, this is one more problem will happen. So in the female, so you know the female secretions help the sperm to move it up. So if there is so much of thick secretions, the sperm will not move up, and females also get infertility. But it is manageable. We can help with the medical science and artificial reproductive technique. Just a minute things are needed, and the female can become pregnant. Okay. So there are the 4 things that is happening. Lungs is getting affected, your pancreas is getting affected, and your reproductive organs are getting affected. Okay. How will you manage it? So we can, if there's a deficiency of amylase, protease, lipase, so you can directly add them into your food, sprinkle them with your food. Just imagine this is my food, this is my plate. So I will sprinkle my amylase, protease over the food, and I will give to the patient, because it is need to be given with food, because you want to digest them, not after, not before. Understood? You will give for patient oxygen, because the secretions are very thick and this is a blockage. So you
Yes.
need to be, position will be upright. Hydration is important.
Nebulization, ma'am.
Yes, nebulization to thicken, to
Just
soften
physiotherapy.
the thick sputum. You will give mucolytic. What is mucolytic? Acetylcysteine. Write it down, acetylcysteine. Dornase alpha. So
Yes,
2
ma'am.
drugs. Acetylcysteine, Dornase alpha.
Ma'am, bronchodilators.
Yes, bronchodilator might help in severe cases. Yes, definitely. Chest physiotherapy.
Just physiotherapy.
Okay, what next?
Antibiotics.
Very good. Antibiotics, because the child is very, very prone for infection. Vaccinated up to date. Vaccinated up to date. What is acetylcysteine? Anyone can tell me what is acetylcysteine?
Acetylcysteine.
Neurotransmitter.
Vanam. Acetylcysteine. Rosaline, acetylcysteine. What is acetylcysteine? Everybody knows this drug.
Yes, ma'am.
Rosaline, where is your friend Uzma today?
Ma'am,
Ma'am,
Mytica, ma'am.
mucolytic agents.
No, we know what mucolytic. Just now I told you it's mucolytic. But what is acetylcysteine? What is paracetamol?
Anti-inflammatory. Sorry.
Proton pump.
What is antidote of paracetamol?
Anticystylin. No.
Rupa?
Acetaminophen. Acetaminophen.
Okay, Bhavna, very good. Bhavna,
Arey yaar.
acetaminophen is the name of paracetamol. Paracetamol is a brand.
Okay.
Nowadays we call it as paracetamol.
Yes.
Antidote.
Sorry.
N-acetylcysteine is antidote of your paracetamol. Come on, everyone. Very basic. Should know it. Okay. Leave it. Okay. Yes, you can give broncholytic. In severe cases, yes, mucolytic. And what is exporant?
Sorry, ma'am.
What is Dornase alpha?
Ma'am, Dornase alpha.
Write it out, Dornase alpha.
Just you told us, like.
It is a mucolytic drug.
Mucolytic.
It is a mucolytic drug. Dornase alpha. Go and study about Dornase alpha. Okay, in your break, you will study about a Dornase alpha. Spelling is DORNASE, Dornase alpha. Okay?
Right.
Okay. very
Okay, ma'am.
So this was all about your okay, one thing. So you're going to give your fat soluble vitamin. What are fat soluble vitamins?
Ma'am,
A,
vitamin A,
K.
D, K.
Yes.
ADEK.
Yes,
ADEK.
ma'am.
So you can
Yes.
convert it into water soluble and you're going to give them because they need it.
Yes, ma'am.
Okay.
Yes, ma'am.
Vitamin A, D.
Vitamin A. Okay. Okay. So sweat chloride test is done. So what is this? We produce sweat. Like we will ask the patient to run for a short time and we will take a sweat and we'll study it. So there will be a higher value of chloride. So a sweat chloride test. Okay. Okay. Now a good question come. How will you make a child sweat? Like a newborn child. How will you do a newborn child? How will you produce sweat in a newborn child? Homework. In break, you are going to study this also. Write it down, homework. Think it and tell me. There's one drug which is used. Okay. And you know what? Initial style of a child, like what is the best when we are talking about gene, your best method will be your gene therapy. Like gene therapy, we can go or we can do a gene assessment. Like a child is suffering from cystic fibrosis or not, or it is in the family or not. Okay. So we can do this is a recessive disorder. So both the family need to have a defective cystic gene, then only can a child will inherit this thing. So a gene assessment is the best method to assess this disease. Understood, everyone?
Okay, ma'am.
Yes, ma'am.
Okay, very good. Let's take some short break. I'm going to give you 2 break today. So let's take short break of 5 minutes. Come back and study those 2 questions I have told you. And then we are going to do more questions. Okay?
Ma'am, question repeat करे जरा, please.
Shashikala, BSCR,
Yes.
repeat the question, help your friend.
Yes,
Batao.
ma'am. Do you want to repeat my question?
Yes,
How to
Shashikala, yes.
Yes, please.
how to produce the sweat to infant?
How to produce.
Next one, Darnis
One question only I know,
sulfa.
Anna.
Darnis
Dorfman.
Another
sulfa. That
like this
also.
mucolite. Mucolite.
Yeah.
Mhm.
Dorni sulfa.
Thank you. Thank you.
Thank you, Anna.
One, back to the class. Okay. So let's do the questions.
Yes, ma'am.
Let's do the questions. Okay. I will ask anyone of you to read the question. Can you see my screen? Farhad, read question number 127.
Ma'am,
Yes.
before start the class, these questions, actually, I want to discuss something. The study.
Okay.
Like it's really difficult, and for me it's really difficult, like revision. Like for an example, we completed the whole neuro, right? And now whenever I do the questions now, at that time it's like I forgot the little basics. Like I know and I remember, but not the proper one which I already learned in the class. So
Understood.
it's really
You know what?
complicated.
If you think that, first of all, Bhavna and everyone, this is very something important that I want to discuss with you. It has been a week, like more than a week now that we are studying. Okay. Like, it has been 10 or 15 days now. So, and like, a month that you are attached to us. We had completed 2 unit, like 2.5 to be very precise, we have done with you. Okay. So, you have to do one thing. If you will think that I have to study, you will never study those topics. Whatever I'm
Yes.
telling you right now, what I like, for example, I taught you about cystic fibrosis. So just immediately after the class, you need to do one thing, because this is the best time you can give it to yourself. Give 15 minutes to yourself. If I end the class like anytime, after 15 minutes, take this 15 minutes for yourself. Read whatever you had understood till now. Explain yourself to your brain. Go and stand in front of your mirror. Don't need to in front. Sit, talk to yourself कि what I have studied. Like, okay, भावना preferred in हिंदी तो
Yes,
ठीक है, मैंने cystic fibrosis पढ़ा, इसके अंदर CFTR जीन था. क्या होता है? रिसेसिव जीन है, मतलब दोनों पेरेंट्स इन्वॉल्व होंगे, 3 ऑर्गन को खराब करता है. मेरे 3 ऑर्गन, मतलब कि इमेजिन करो कि ठीक है, पैनक्रियास खराब हो गया, लंग्स तो खराब हो गए, उसके बाद मेरे रिप्रोडक्टिव ऑर्गन, 3 ऑर्गन मेरे अफेक्ट करता है. कैसे करता है ये? मैंने इसको ऐसे देख लिया कि ये इस तरीके से आके ये मेरी बॉडी को अफेक्ट करता है. इसके अंदर ये प्रॉब्लम होती है. हमेशा ऐसे देखो, अगर इस डिजीज की वजह से मुझे ये प्रॉब्लम हो रही है, मुझे इसको सॉल्यूशन देना है. अच्छा, पेशेंट को निमोनिया हो जाता है तो मैं पेशेंट को एंटीबायोटिक दे पे रखूंगी, मैं उसका ब्लड टेस्ट करती रहूंगी. उसके बाद मैं क्या करूंगी? पेशेंट का चेस्ट फिजियोथेरेपी, ये सब करते रहूंगी.
Chest physiotherapy,
ऐसे करके आप खुद से
nebulization.
बात करो. टॉक टू योरसेल्फ. बेस्ट थिंग, रीड एनीथिंग, टॉक टू योरसेल्फ. ऐसे नहीं कि इसके अंदर ये होता है, इसके अंदर नहीं. टॉक टू योरसेल्फ. ओके, यू आर मेकिंग योरसेल्फ अंडरस्टूड द टॉपिक. ठीक है, ये चीज बेस्ट यही थिंग है. एवरी डे जो जो टॉपिक्स पढ़ रहे हो, यू हैव संडे, यू हैव सैटरडे विथ यू, जिसके अंदर आपको इधर यू गेट अ पार्टनर टू स्टडी. ठीक है, लाइक शशिकला, रूपा, बिकॉज पार्टनर्स best study. If you're good together in learning, if you want to learn together, you're not talkative enough, so you just take a partner with you. You like take a half an hour, not more than half. If you're talking to your friend or your study partner more than half an hour, it means you're wasting time. So like make one thing, there has to be one specific time of your day, only half an hour, not more than half an hour. So you just, so you have a strangulation of time. Okay, so you have a like, okay, I will not go more than this thing. So half an hour time, you will ask, okay, I'm closing my notebook. You open your notebook and see if I'm right or not. So you're just dictating whatever you have learned. Learn. So for example, I'm asking Shashikala to listen to me. So I will ask Shashikala, okay, listen, Shashikala, you open the notebooks, okay, and I'm telling you with closed notebook. So this is what happened in this disease. This is what happened in pneumonia. This is what happened in cystic fibrosis. This is happening in ARDS. This is what atelectasis. This is how chest tube works. So this is what ventilator. This is what mode. So in half an hour, you have just repeated one thing with the Shashikala. And now Shashikala will ask, okay, it's not my turn. Like only 15 minutes to you, 15 minutes to Shashikala. So in 15 minutes, Shashikala will tell whatever she know. And then both of you can see, okay, this is my lag point, this is my, go home, learn it for 15 minutes, read it 15 minutes, keep in your mind and repeat. When you're doing anything, you're walking, repeat, okay, chal rahi hu main cystic fibrosis, ye wala topic bhul gaya tha, dekh leti hu main kya tha. So this is how you can, maximum you can give 1 hour, 45 minutes, more than enough, and do practice question. And if someone who is working, this is the best thing. The best thing to learn a thing is to teach. Nothing the best. There's a person called Fryman something. He was a psychologist. He had gave this concept. If you want to learn something, just start teaching it. Ask anyone to read it for you. Be very clear. Ki, okay, this is what the disease is. This is what I know in this thing. Don't go for anything extra. Go for the basics. Go for the basics. If you know your basics on your tips, then you will do it. Okay. Try this habit. If you're a person who study alone, very good. Make a timetable for yourself. Okay, this is like what I used to do when I used to study. So I don't know. I asked someone who was my friend. So she passed the exam. So I was like, okay, I was very furious. Ki, what do you do? So she told me like at the end. So I used to give myself a target. Ki, before sleep, I need to do this thing. So I used to make myself very strict. Okay, 85 question I have to do. And start recording it. In the end of your page, make a column. Okay, today is my day. So this is, don't make a timetable. I'm not asking you to make timetable. I'm asking you to make your to-do list. Okay. And tick if you had completed or not.
Yes, ma'am.
Understood? This is the best method that you can do.
Yes.
Think,
Thanks.
keep data in your brain, not in the notebook. 15 minutes of reading is best. Take one topic, read it for 15 minutes and store it in your brain. Then after 15 minutes, not more than 15 minutes, 15 minutes, I'm talking the maximum. It takes only 5 minutes or 6 minutes to read one topic. Okay.
Yes,
This way you can do. Okay. Apart from this thing, let's start with the understood. Try this thing one week. If it works, it's good. Otherwise, we will shift to something else. Okay.
Yes, ma'am. Thank
Do
you,
this
ma'am.
thing. If it works, it's good. Otherwise, we will go for another plan B. So there are so many plans available. Understood? Okay, read this question for me, anyone?
Yes, ma'am. A nurse has received report on 4 clients. Which client would be the nurse visit first? A client with congestive heart failure who has gained 2 pounds overnight. Second, a client with tuberculosis who raised 50 ml of sanguineous sputum over the past 2 hours. Third, a client with C. difficile who continue to have loose fouling smell stools. Fourth one, a client with chronic obstructive pulmonary disease whose last report of oxygen saturation was 91%.
Very good. Now tell me, among these, what is the normal? What do you think is normal for you?
COPD. I mean,
Ma'am,
it is
Which is normal? Which is expected and normal?
ma'am, sanguine sputum.
2 is normal, 4 is
Client with
normal.
tuberculosis raised sanguine sputum because
I'm
there
not
is a
asking you
chances
for
of
the
bleeding.
disease. I'm asking
COPD.
you. Very good. Who said COPD?
Shashikala.
Shashikala, very good. Listen, in these 4 conditions, your patient is with COPD and oxygen saturation is not 91. My patient is okay. My patient
Yes,
is
ma'am.
okay. 91 SpO2 is 88 is also expected. 89,
Yes.
90, 91 is expected in COPD. So my one patient, I had eliminated one option. If this patient is normal, then I will not look at it first. Which patient will I look at it first? The patient who is
Second.
most dangerous, who is about to die. Among this thing, my patient of COPD will not die soon. Okay. So you have to look for this condition. Next, go for option number 3. Client with C diffusion who continues to have loose and foul smelling stool. Anybody know what is C difficile?
Yes, ma'am.
What is C difficile?
Cholera, kind of.
Very good. C difficile is Clostridium difficile. It is a spore-forming bacteria, which is very bad. We keep patient on contact precaution and enteric precaution. We wash our hand with soap and water with this disease. And this is what disease is actually. Loose stool, foul smelling stool, diarrhea. Loose stool, foul smelling stool. This is the characteristic feature of your C. difficile. So this is normal. Yes or no? If a patient
Yes,
is
ma'am.
saying, I cannot walk, and when you look at the legs, there were no leg present. The legs were amputated. So will you keep a patient on priority? No, because you know
No.
you can't walk because you don't have legs. Similarly, this is normal and expected in this patient. Nothing abnormal. This is what a characteristic of this disease is. Okay.
Yes,
Yes,
ma'am.
ma'am.
Okay.
Yes, ma'am.
Next, read option number 2.
Ma'am.
This is the
The-
correct. This is
Ma'am,
the primary, ma'am.
Read.
A client with tuberculosis who raised 15 ml of sanguineous sputum over
Okay,
the
wait.
mask.
What is sanguineous mean to you?
Ma'am, sputum, blood in sputum.
Very good. Sanguineous mean red color blood. If I say serosanguineous, it means
Sorry, ma'am.
pinkish color. What is serosanguineous?
Ma'am,
Serosanguineous.
pink color.
Yes, kind of pinkish color with mucus also present.
Pinkish
So
color.
if it's saying
Yes, ma'am.
sanguineous, it means a patient is,
Infected sputum.
yes, pink frothy sputum. Sanguineous
Yes,
means
yes.
blood in the
Yes, ma'am.
Pink
sputum.
fruity. Yes, pink.
Over past 2
Yes,
hours.
ma'am.
The condition is very acute. It has been 2 hours and the patient is 50 ml. 50 ml is a good quantity. 50 ml. 50 ml of blood is coming out of a patient's throat. Read the
Ma'am,
number
there
one.
is like tuberculosis, so there will be a chances like airway obstructions.
Yes, airway obstruction. No. Tuberculosis is a chronic condition. Okay, this is also a chronic condition. Tuberculosis does not happen in one day. But the patient is coming to you with a situation where there's a blood coming out. And when the blood come out, there's hemodynamically, patient is unstable over here. If the blood is moving out of the body, so it means that the patient is hemodynamically unstable. Their BP will going down because volume is being lost from the body. And if the volume
Internal
is lost,
bleeding.
patient will go into shock. Yes, it indicates that patient is having bleeding. Simple indication of bleed. This patient is bleeding. Yes or no? Sanguineous means blood. Patient is bleeding over here. Next, question number 1, option number 1, read it.
Client with congestive heart failure who has gained 2 pounds overnight.
So, don't you think that it is a priority? So, within a day, a patient has gained 2 pound. Anyone?
Yes, ma'am. But
Is
I
it
think
priority or not?
Because of edema.
It
Tension
means
of
that
it is
heart,
yes, ma'am. It
fluid
is
accumulation.
worsening of heart failure.
yes, it is a worsening of heart failure. Very good.
Heart
But
failure.
read one thing. You have to listen. This is expected. This is also expected. But you have 2 options where you want to decide. One is bursting of a condition, and in second option is directly speaking that the patient is your hemodynamically unstable. Which one will you choose?
Ma'am, I think
Hemodynamically
second.
unstable. Second, ma'am.
Second?
Yes.
Yes. You are going to choose your second. Understood?
Ma'am.
Why?
Yes,
Because
ma'am.
patient is hemodynamically unstable over here. Hemorrhage, blood, the patient is bleeding. Okay?
Yeah.
Understood? Okay.
Yes, ma'am.
Can
Yes,
anyone read?
ma'am.
I want you to learn how to read a question. Can anyone read the question number 128 for me? Not Bhavna, other than Bhavna.
Ma'am, I have one. Sorry, ma'am. The first question, the cholera is continuous loose stools, ma'am. So continuous loose stools have dehydration.
But when
So
where
they
it is saying dehydration, is any specifically maintaining
no,
you
they
saying
didn't say, but continues to have loose, foully smell stools.
this is the characteristic feature of the diarrhea. This is the characteristic feature of this disease. Patient is having disease which we already know. If it had been written like this, a patient with C. difficile who is having loose stool, diarrhea, loose stool are different things. Loose stool is saying, okay, and the patient is pale, heart rate is dropping, BP is unstable, then my patient. It has to mention some kind of element which
Patient
depicts here.
going to
I would have never
hypovolemic
gone for
shock.
this. Yes.
Yeah, patient go to the hypovolemic shock. Fluid loss, right?
Yes. Govinda, you're speaking to me or someone else? Okay, good. Let's go for this question number 128. Can anyone read this question for me?
A client with chronic obstructive pulmonary disease, that COPD, has signed living with do not resuscitate, like DNR request. While a wife was visiting the clinic.
Wait. You're going very wrong over here. Read question. You are really reading. Don't. Do I read question like this? Even my throat is. I cannot speak, but even I'm reading it good. Read question like a question. These questions are your destiny. So read with very courage, like you should be very, very strong, firmly speak your word. When you will read question correctly, you will answer question correctly. So read in a good tone.
A client with chronic obstructive pulmonary disease.
I'm reading this question for you. The next question you're going to read, okay?
Okay.
A client with COPD has signed a living will to do with a do not resuscitate. It means that my patient has signed a DNR order. This is what I have understood from the question. Next, while the wife was visiting the client, he had
Cardiac arrest.
while the visiting the client, he had cardiac arrest. So when the wife came, immediately the patient had a cardiac arrest. The wife requested the client to be resuscitated immediately. Now, what is happening in this scenario? My patient signed a DNR order first, then the patient went into cardiac arrest. At that time, the female is saying that I want, please resuscitate my husband. Okay, next, when the nurse hesitated to start resuscitation, the wife threatened to sue the hospital. Now what is happening? The wife is saying, if you will not resuscitate, I'm going to sue you to the court. Mean that the wife is threatening now. What should nurse do? Select all that. Did you understand the condition? A patient signed a DNR order. Patient went into cardiac arrest. The wife came and said, please resuscitate my husband. You said, no. And the wife said, I'm going to see you to the hospital. You need to resuscitate my husband. What you will do as a nurse? Understood the question? Rupa?
Yes.
Yes, ma'am.
Next. Sixth option saying that notify the healthcare provider. Fifth saying call the chaplain to come over and remain with the wife. Fourth, notify the nurse manager about the situation. Calmly remind the wife of the client wishes and DNR. Carry out the written DNR request and client wishes. Call the code for fear of being sued by the wife. Now everyone is going to tell me the answer. You can type it out or you can speak it out.
2, 3, 4, 6. Monitor 6.
So whenever we study the question about SATA, we always go for true and false method. So take one statement, ask yourself whether this is true or false, and then come with the answer. Okay? In SATA question, One option will never be the option, and two, and all of the above will never be the answer. So there's negative marking associated with it. Think wisely and answer it. Partial marker is given.
Don't know, man. I will go with 2, 3, 4.
Very
Okay.
good. Yes, more options. I want you to just type. You don't get this much of time.
And second option, notify the healthcare provider.
This is SATA.
Yes. Second, 6. Calming
Ma'am,
remark.
what is
हम भी करेंगे मैम.
chaplain?
Second, third,
What is chaplain?
fourth.
Like
Solve the
faster.
chaplain.
Ma'am, second, third,
It's like
fourth
a
or sixth.
counselor.
Second, third,
4, 6.
4, 6. Very good. 2, 3, 4. Very good. Farad, you want to ask something else?
I
2,
was
3,
just
4,
thinking,
6.
what is chaplain?
Yes, chaplain
Chaplain is a person who give you spiritual help. So chaplains are like pujari or father or Maulvi Sahab. So these are chaplains. Understood?
And then maybe
Okay.
this is all the option. This one is fifth is maybe because they can calm down the
But
her wife, his wife mind
but
because she's
but in
angry.
hospital, where would we find a chaplain?
Good question.
Yes.
Hospital have everything. You name it, they have it.
But I haven't, and we haven't seen in this hospital.
They come on contract basis, like you need to call them. So we have hospitals. We in the hospitals we have some place where we can go for like puja or something. It is there. It is there. Even in your hospital, you have some place where you can go and pray.
टेम्पल तो होता है मैम. Yes, temple
हाँ
type. छोटा सा.
हाँ छोटा सा रूम होता है. There is a छोटा सा. चलो, okay. So the answer is 2, 3, 4, 5, 6. 2, 3, 4, 5, 6. I think everybody got correct. I'm so happy. Listen, you will not call the code like you're being fair. Like, okay, somebody is saying somebody is angry, and it is very normal. It is very expected to get angry in this thing. But first of all, let me read this. I told you the scenario. Tell me one thing. Will you go and directly sue like, can you change the patient's order on the wishes of a wife? No.
No, ma'am.
No, ma'am.
The wishes are the wishes of the patient. No one can change. Not even the healthcare proxy can change. Not even the healthcare proxy can change. These are the wishes by the patient. No one can override it. Even the healthcare proxy, yes, even the healthcare proxy. They cannot override the wish of a patient because this is my wish. I want. If I had written this thing that I don't want resuscitation, even the healthcare proxy cannot change my order. If there's something which is dicey, if it's not written about DNR, then healthcare change make a decision on my behalf. But if I said my wishes, my patient as a patient is my priority. Okay. So this is very natural. Understand a question like a exact scenario. You're going to get a question like this. These also in your question. So read a question like exactly what is happening with the patient. So you will call the code. No, you're not being feared. You're just a patient is very angry. You need to calm it down. So the solution you are going to do. So this is not answer. Carry out written DNR request. Yes. Yes. You will, whatever the patient had said, you will carry out what the DNR. Do not resuscitate. Do not go for CPR. Resuscitation means CPR and ventilation. So you cannot artificially ventilate also other patient. Calmly remind. Yes.
I have one confusion here.
Yes.
That why option 5 is correct. But I mean there is
Yes, let me come to
Ma'am.
let me come to the point. I will tell you why. Listen, best answer whenever we are going for SATA questions, read the options like calmly, very normally explaining. This is the very therapeutic answer. When someone is angry, you will not go and shout at them. You will be like, okay, calm down. Let me explain you the patient wish. Let me again tell you, don't worry. You will like, do not say don't worry. Don't worry is not therapeutic. Just say, keep, I understand you are very angry at the time, at this moment of time, but the patient wishes, I need to respect it. And you should also respect the, not you should, like, this is the patient wish and it need to be implemented. Okay, this is how you are going to explain this thing to the family member or the wife. Okay. This is the very most, if I would have gone for one option, I would have picked this one. It's the very therapeutic in nature. Okay. Notifying the next manager, yes. Yes. You will not notify, it is required. Next, call the chaplain to come and remain with the, yes. You will ask someone from a spiritual need. If it is SATA, you can go for this thing. It will further help a patient to calm down because this patient needs some spiritual need. She's just losing
मुझे
something very
chaplain का
important.
मीनिंग नहीं पता था तो प्रॉब्लम हो
अच्छा
जाती है
बता देना chaplain का मतलब ये था, ठीक है, चलो कोई बात नहीं. And listen, you need someone spiritually heal a patient right now because the patient is going into grief, dabda, denial, anger, bargain. You need someone who can spiritually heal it. You can just, because you know this patient will go into grief. Whenever there's a loss, there's a grief, and whenever there's a grief, there's a dabda. So you need someone spiritually help the patient. Yes, notify the healthcare provider will never go wrong in SATA questions. Understood?
But ma'am, there are people who are not spiritual, like, so.
Listen, very good. You mentioned this point. I will appreciate. Listen, one thing. Whenever we are solving NCLEX question, we will not go for such responses. We think that this world is normal. Everybody believe in God. Okay.
Ma'am,
This is what
like NCLEX marking is like this, like we correct 1, 2, 3, 4
okay, for
questions.
example, in NCLEX, you have answered like 1,
4 correct.
2, 5, 6. Like you, okay, among your listen, there needs to be correct. Like there should be 5. This total,
Yes.
the maximum marks for this question was 5, and minimum is
Yes.
0. Minimum is 0. So, for example, if you have corrected 4 option correctly, you will get 4 marks. If you opted 3 option correctly, you will get 3 marks. But if you had put 1 correct and 1 option incorrect, like for example, if you had also went for option number 1, and if you had selected all of them, like 5 option, then you would have gone 1 negative. So your point will be, what you will answer?
Ma'am, I have
3. You
I
will
have
get
like
3 marks.
one more confusion. Like,
Yes.
for example, I did not select the option number 5. Okay, so will they deduct the negative marks for it? Because I did not
No.
select that option.
No. If you have not choose, you will not get negative marks. If you would have choose 1,
Incorrect.
then you would have got, yes. Understood?
Yeah. So if we leave, if we did not select the right one, so the marks will not get deducted.
Yeah,
Okay.
that's okay. They will not get negative marking for this thing. So you will get how many of you, how much did you correct?
4.
4. So you will get 4 marking. You will get 4 marking. You will not get negative marking for not mentioning it. Okay. You will get negative
So
marking
ma'am,
if you mention the wrong one.
so the trick here is that we should only select the option we are 100% sure.
Yes.
Don't go for like.
Yes.
Mm.
Yes. This is what
Yes.
exactly happened with me when I went into, I got a first case study. I was very, very sure that this would be the answer, but I hesitated to click it because I don't want to negative marking. But when I went to the next question, I thought, okay, this was the correct answer and I should have marked it out. This is what
And
exactly
ma'am,
happened. So
in
on
exam,
eventually.
yes, in exam, like if we completed one question and we again back to that question, so can we or not?
No. Can't go back.
Okay, if we submit and submit, we cannot back to that question.
Chalo, okay. Farhad, read question number 129. Farhad. Okay, leave it. Farhad.
Yes.
Read it. Yes.
No, I can't see 129. It is 128 in front of.
Read.
I said,
Ma'am,
ma'am,
scroll
it is
the
128.
मैम
Yeah, you need to
129
scroll.
शो कर दें.
Please scroll down.
128 129 ही दिख रहा.
Can you see the last line? The nurse has received
Yeah,
a
the
change
last
of
line.
shift
The nurse
report.
has received a change of shift report on. What is
On?
after that?
On client.
On clients. On clients, yes. Okay. So which client should the nurse assess first? A client with COPD with
Perhaps read question again. You're not reading it correctly. Read like a question. You should calmly speak a question. You should, by reading your question, you should get a scenario in front of your eye. What exactly happened? Read it again.
the nurse has received a change of shift report on clients. Which client should the nurse assess first?
Yes.
Okay. A client with COPD with a PO2 of 56 mmHg who is being discharged home on oxygen.
Yes.
Option number 2. A client with asthma with respirations of 36 breaths per minute whose wheezing has diminished. Option number 3. A client with asthma who has a heart rate of 90 bpm and whose beta blocker is scheduled to be administered now.
Yes. Option 4 is written with this.
Okay, option 4. A client who is scheduled for an angiogram now and is ready to be transported. The nurse is caring for.
But
Okay,
only
so
this
it is.
till now, till here, till here. Just till
Okay,
now.
it will be transported.
Tell me your answers.
So, yeah, client with asthma with a respiratory of 36 breath per minute.
Write it down.
Is
Write it
yes.
down in the chat box. Govin, let everyone answer it. Let everyone think it. You just write it down. Your answer in your chat. I'm seeing your chats. These are the questions that you really need to practice. And do not copy Govind Raj, okay? Have your individuality. Rupa, you were trying to. Quick, we have to finish this question today. Now I'm 100% sure that from Monday onwards, I'm going to teach you about nursing foundation because your nursing foundation is not good. I can see this thing. Okay, then I will go for cardio. Otherwise, I would have gone for cardio. Okay, answer is 2. सब सो रहे हैं, कोई आंसर नहीं कर रहा. Not good.
I
Okay?
answered it, man.
I know.
We
Okay.
can't get the easier question than this. NCLEX.
This is the most easiest question among
Yes.
all the things. This is the
Yes,
most easiest
that's
question.
what I said.
The question is, listen, rule, question number 1. COPD, oxygen 56. Yes, it's bad. Yes, it's bad. But my case, the oxygen is going down. I am giving oxygen. There's a problem. I am giving solution. And third thing is patient is being discharged. It means my patient stable. Stable patient are the patient who get discharged. There's a stable patient with discharge. Oxygen is going down, but I am giving oxygen. There's a problem. I am giving solution. This patient is my fine. Understood? This patient is stable because patient is being discharged. Number 1, problem, but I'm giving the solution. Stable patient. Option number 3, asthma, heart rate 90, normal. Heart rate 90 is normal. Everybody know heart rate is normal. And then
Yes.
beta blocker is scheduled. Now it's okay, normal. Okay. Next. 4th, a client who's scheduled for angiogram. Okay, there's angiogram. Now is ready to transported. There is a patient who is just simply, I'm doing a procedure on a patient and the patient is being transported. Simple, normal patient, healthy patient. Option number 2, asthma, respiratory 36, and patient is wheezing, diminished, airway has blocked. Priority, number one, respiratory priority. Okay. Next, can anyone read this question number 130? Start from this line. The nurse is caring for a group of pulmonary unit. Emmanuel, can you read this question for me? Okay. Govind Raj, read this question, 130 question. Okay, from this line. The nurse is caring for a group of client on pulmonary unit.
A nurse is caring for a group of clients on a pulmonary unit. They can delegate which task to unlicensed assistive personnel. Option A.
Okay.
Option number 1. Assisting a client with adjusting his or her nasal cannula, making adjustment to flow rate based on client response. Third one, monitoring a client for advisor effective of the oxygen therapy. Fourth one, assisting a client for the best method of oxygen delivery.
Till now. So you're working, let me answer this question, let me help you. So you're working in a unit and you're a pulmonary unit. Okay, you're caring for a group of clients. So which work can you dedicate to delegate to the UAP? First, assisting a client with adjusting his or her nasal cannula. So you will ask, okay, go UAP, go and just adjust the nasal cannula of this patient. You will ask the UAP to do this, or you will ask, okay, UAP, listen, can you just adjust the flow rate based on the client response? So it's like as a RN, I'm telling a UAP to go and to look the client condition and manage the oxygen. Can UAP do this thing? Yes or no, you will tell me. Third option says this. I'm asking a UAP to monitor a client or adverse effect of oxygen therapy. I'm asking, go UAP, go and monitor the client for adverse therapy of oxygen therapy. Fourth, I will ask a UAP to do assessment of a patient which is the best method of oxygen delivery. First of all, UAP will come to you and say, I don't know what oxygen therapy is, madam, so I cannot do this thing. I don't know how to monitor, I cannot monitor. I don't know how to assess, I cannot assessment, because these are the not function of a UAP. UAP can only assist you. Okay, I want to take, just go take a BP. Assist in patient
कोई भी
coping,
नहीं है.
assist in coping. Yes. So these are the work of a UAP. Number 1 is a correct answer. Okay. Next, can read question number 131. Start with a confused client with carbon. Bhavna, can you read this thing?
Yes, ma'am. 132 ना ma'am.
31.
A confused client. Yeah, a confused client with carbon monoxide poisoning experiencing dizziness when ambulating to the bathroom. What should the nurse do? First, put all 4 side rails up on the bed. Second, ask the unlicensed assistive personnel to place restraint on the e-book
No, just don't read this thing. Don't read this thing. On the client's
Restraint
upper extremities.
client upper extremities. Third, request that the client's roommate put the call light on when the client is attempting to get out of bed. Fourth, check on the client at regular intervals to ascertain the need to use the bathroom.
Yes. Fourth. Okay.
Fourth,
Done. So what should be the answer?
I think
you have a confused client, okay, due to carbon monoxide
I
poisoning.
think I'm check on the client at regular interval to need to use the bathroom.
Okay. What your answer, option number 1 is saying, put all 4 rides up. All 4 rides up means that patient, you are restraining a patient. Putting a rails up means that you are restraining a patient, which you do not do. Okay, this is not expected. Next, option number 2 says that You will ask a UAP to restrain. Never, never, never. Restraint comes as an order. Restraint is a prescription. It needs to be prescribed by your doctor and done by an RN. So you will never restrain. Okay, confused clients are not restrained. Combative clients are restrained. Request a client roommate to pull call light. Never. You will never do this thing. You will never ask someone else to help a patient. Never ask any other patient to help another patient. It's not a function of a patient. Okay. So no, you will not request a roommate to pull call light when the client is attending. No. Patient are patient, you are responsible. The patient is not responsible for another patient. So this is wrong. Never choose this answer. Anyone of you thinking of this answer? No, do not choose this answer, okay? Next, question number 4 is that check on regular interval. Yes, I will check on interval negative and help a patient to go for a washroom if needed. Okay. Can read number 130, read question number 132. Who's going to read? Yes, fourth one. Priya? No, we have Priya in the class. Rosaline, read question number 132.
Check on the client at regular interval to ascertain the need to use the bathroom. The nurse should use which type of precautions for the client being admitted to
No. Okay,
hospital?
read it from here. The nurse should use which type of precaution?
Yes, ma'am. The
Read
nurse
it.
should use which type of precaution for the client being admitted to the hospital with suspected tuberculosis. One,
Yes.
standard precautions. Second, contact precautions. Third, droplet precautions and airborne precautions.
You tell me the answer. Everybody knows
Airborne.
airborne precautions are
And
applied.
airborne.
Okay.
We need to maintain a negative
Airborne
pressure.
protection.
Yep. Very good. Can you read this question number 133? Anyone? Shashikala, 133. Read it. Shashikala,
Yes, ma'am. Yes, ma'am.
133.
Yes, ma'am. A client has developed a hospital-acquired pneumonia. When
Wait a second.
preparing
Shashikala, what is hospital-acquired pneumonia?
hospital-acquired pneumonia means within um, after admitting the 72 hours, the pneumonia will occur.
Yes, very good. This is what I. Read it.
A client has developing a hospital-acquired pneumonia when preparing to administer the
Cefalexin antibiotics.
Ceflexin, yes, 500 mg. The nurse noticed that the pharmacy sent the ceftriaxone. What should the nurse do? This SATA question. Administer the ceftriaxone and second number is verify the medication prescriptions as written by the healthcare provider and contact the pharmacy and speak to the pharmacist. Request the ceftriaxone be sent
Promptly. Promptly means very quickly, very fastly.
return to the ceftriaxone to the pharmacy.
Okay. So you want to give cefalexin to a patient and pharmacy send you cefalexin. What will you do? Sata. Return it. Simple. Go and return it because you tell them my doctor has said, my doctor asked for cefalexin. You are giving me cefalexin. Take it back. So returning, yes, you will return it. Fourth,
Yes.
request that cefalexin to be sent properly. You will call the pharmacy and listen. Please send me cefalexin fast because I want to give it to the patient. Okay, this is what you will go. Contact pharmacy and yes, you will go and contact pharmacy, call them. You send me the wrong medication. Take this medication, send me the new medication promptly. You will do this thing. Fourth, verify the medication. Yes, you will again check because the same data is present with you and the same data is present with the pharmacy. You might have gone wrong with the pharmacy. Go and verify again. Verifying best. Administer cefalexin, never. This is wrong, okay? Whenever going to medication, wrong medication to a patient, you will go to jail.
Yes.
Next, 134. No, the answer is 2, 3, 4. Yeah. 5 also. 5 also. 2, 3, 4, 5 is the answer. Except 1, everything's answer. Okay. Can anyone read this question number 134 for me?
Yes, ma'am.
Read it.
A nurse received the tab change of shift report for assigned clients and prioritized client rounds. In what order from first to last should the nurse assess these clients? All options must be used. First, a client who has an endotracheal tube and who will be transferred to a long-term respiratory care unit that day. Second, a client with type 2 diabetes who had a cerebrovascular accident 4 days ago. Third, a client with cellulitis of the left lower extremity with a fever of 100.8 Fahrenheit. Fourth, a client receiving dextrose 5W IV at 125
5% by weight IV. 5D5 weight. 5% by weight. Okay, this is how it's written.
IV weight at 125 ml per hour with 75 ml remaining.
Just till now. Yes. So you have 4 patients. You need to see patient in priority wise. So which patient you will see first and which patient you will look for the last. Read the patient. What is happening to patient 1? It is a patient with respiratory care unit and the patient is having ET tube. This ET tube.
Ma'am, all the option must मतलब starter type ही है ना all the.
ना सब यूज करना है आपको रैंकिंग वाइज. अगर एक भी रैंक गलत करोगे तो पूरा गलत होगा.
अच्छा ओके सीक्वेंस होता है all options
हाँ,
मस्ट.
इसमें सीक्वेंस यूज करना. It's okay. Best of luck for your night shift routine.
Thank you.
Happy, be happy.
Thank you. Thank you.
Okay. Tell me one thing. Listen, you have a first patient.
Ma'am,
Yeah.
first, third, fourth, two. First, third, fourth, two.
Okay. Parhat 3, 1, 4, 2. Okay, let me read it for you. So there's a patient with ET tube and you want to transfer to the long-term respiratory facility. Okay? Okay. Okay. Next, a client with type 2 diabetes. Okay. So type 2 diabetes is chronic condition who had CVA. Okay, now this is my problem is related to brain now, but it has happened 4 days ago. So the client will be priority for my first 24 hours, but it has already been 4 days till now since that.
ABC
Third,
लगेगा.
there's a cellulitis and a fever. Cellulitis means inflammation of your cellular layer, tissue layer, and there's a fever. So fever is a sign and symptom associated with the cellulitis. Yes, this is a priority, but fever is very normal. 108 is normal. Next, there's a client who is receiving, I don't know which client is, so I consider this a normal client. So I have a normal client whose fluid is going at a rate of 125 per minute and there's 75 ml is remaining. So 75 ml is remaining. Can you calculate it? What is the time? How many times going to remain it? 30 minutes, 30 to 40 minutes. So the fluid will be finished in 30 to 45 minutes. How did I calculate this thing? So 125 in 1 hour. So 125 means 125 in 1 hour means 125 ml in 60 minutes. So 1 minute will be 125 by divided by 60 and this 175 ml is remaining.
75.
So you can just calculate it like you will calculate for 1 ml, then you will multiply with 75 and then you will get the time. So approximately 30 minutes is remaining. I have a patient, so the answer is going to be 1, 3, 1, 3, because fever is priority, vitals are priority. Because why 1? Because the patient is endotracheal tube. So your respiratory. So I kept my respiratory as a priority. So I will assess my first endotracheal tube. Okay, then I will go for my patient number 3, because patient number 3. Then I will look for patient number 4, because in half an hour I have to recheck, because the fluid will going to be finished on half an hour. Then I will look for the last patient, because this patient is stable. Only this problem is that the patient had severe cellular-vascular accident 4 days ago. Means the mind of patient is stable. Okay. First, third, fourth, and 2. This is the answer. Okay. Can you read this question number 136? And 135 will be your homework. Read this 136.
Yes.
Shashikala, read this question.
Yes, ma'am.
136.
Yes, ma'am. The nurse is
Shashikala,
yes, ma'am.
the nurse is caring for a client admitted for pneumonia with a history of hypertension and heart failure. The client has reported at least one fall in last 3 months. The client may ambulate with assistant and has a saline lock in place and has demonstrated inappropriate use of call light to request assistant. Using Morse for okay. So this is all about. Okay, leave it. This question, I don't know why it's showing it again. Okay, leave it. I will give you the full question next day. Okay, so class, this was all about respiratory questions. I will do one more. I'm going to give you a better test for your practice, and I will be sending you answer by today. Tell me your marks personally to the number, okay? So I can have a see how much you're doing. If you're doing it more than 50%, good. But your goal should be more than 60%. If you're doing it, if your answer coming out to be in 66%, more than 60%, then only take a breath. If it is coming less than 60, then start again, read again, then mean that you're not good in respiratory till now, okay? I will give you one test related to respiratory. Do that test and send me the answers, okay, everyone?
Okay, ma'am.
Okay, thank you so much. Have a good day.
Tomorrow is off now, ma'am.
Yeah, tomorrow.
Yes. Thank you.
Thank
you,
you,
madam.
ma'am.
Good night, ma'am.
And follow the teaching method of 15-minute study. Okay,
Yes, ma'am. I will try
try that.
my best.
Thank you. Take care. Happy.